When I have the flu or a cough, how long am I contagious? Is liposuction worth it? We have all probably had one of these questions we've always wanted to know the answers to, but now you don't have to stay awake at night wondering how often should you have your teeth cleaned by a professional. We've got your answers to all these questions, so stick around. You don't want to miss our top 5 health questions part 4. Number 1. When I have the flu or a cough, how long am I contagious? You actually start being contagious the day before you get sick. The flu virus does this to speak kind of teleological, making sure it gets spread around. The day you actually get sick is the day you are the spreader. The answer to the question is, as long as you're experiencing symptoms. According to Bill Schaffner, MD, a physician and infectious disease specialist at Vanderbilt Medical Center in Nashville, the ability to transmit these viruses lasts until the last sniffle. You're also contagious for 24 hours before you develop symptoms. Number 2. How often should I have my teeth cleaned by a professional? According to periodontist Sally Cram, consumer advisor for the American Dental Association, the answer is dependent on your daily habits. Bacteria takes about 3 months to take root in the gums, according to studies. Daily flossers and brushers may get away with twice-yearly professional cleanings, but those who neglect their oral hygiene or have a history of gum disease will need visits every 2 or 3 months. Diabetes, autoimmune disorders, and drugs that dry out your mouth, such as antidepressants, can all speed up bacterial buildup and necessitate more cleanings, according to Cram. Number 3. Is liposuction worth it? Yes, but only after weight loss to reshape stubborn bulges. It won't get rid of cellulite and it won't help you to stay slim. According to a report from the University of Texas Southwestern Medical Center, 43% of people who had lipo gained weight afterwards, owing to a lack of adherence to a balanced diet and exercise routine. When you are doing liposuction, we are removing the actual fat cells. Fat cells in other areas of the body can grow and become more prominent and gain visceral fat. Number 4. What's the only way to avoid getting cancer? There isn't one, but there are ways to reduce the risk of getting cancer through things you do and things you can avoid doing in your everyday life. When we think of cancer risk, that refers to something that can cause us to get cancer. The sad fact is that certain people who lead a healthy lifestyle, eating the right foods and exercising regularly can still develop cancer. Even so, bad habits reduce the chances. According to Peter Greenwald, MD, PhD, Director of the National Cancer Institution's Division of Cancer Prevention, tobacco use causes around 1/3 of all cancers, with diet, inactivity, and obesity accounting for the remaining third. There are some things that we have to control over and some that we don't. Number 5. When do I go to the doctor about this? A backache. If your back pain is keeping you from sleeping, you have numbness in your leg, foot, groin, or rectal area, you have a fever, chills, nausea, vomiting, stomachache, fatigue, or sweating, if you have lost control of your urination or bowel movements, have been in a car accident, or have a family history of cancer, see a doctor right away. A fever. Severe headache, neck stiffness, vomiting, and light sensitivity. After spending time outside in the humidity, you feel dizzy and disoriented, signs of heat stroke. If you're experiencing the symptoms, contact your doctor right away. A fever of more than 103 Fahrenheit, bloody diarrhea, a red rash or red lines on your arm or leg, earache, painful urination, sore throat, muscle and joint pain, back pain. Abdominal pain. If you are experiencing one or more of the examples of symptoms, you should seek immediate medical attention. A fever above 102 Fahrenheit, sore abdomen, bloody diarrhea or black stools, sudden sharp pain under your ribs that passes to your groin, backache, bloating and extreme cramping, or you're pregnant and have abdominal or vaginal bleeding. If you're in persistent pain and have vaginal discharge or burning sensation when you urinate, have traveler's diarrhea that isn't responding to over-the-counter medications, or taking a new drug that seems to be causing diarrhea, call your doctor right away. That wraps up part 4 of our top 5 health questions for today. Check out part 3 if you missed it to find out if you should get the flu shots or not. Don't forget to subscribe and turn on notifications so you don't miss more videos of health and wellness advice and much more. See you in the next video.